Okay, hello everybody. So my name is Kelly. I will be going through the myth and facts about physiotherapy and women's health today. So what happened is I'm actually from EMW, a bit of history about myself. I'm actually from EMW Physiotherapy and TCM Clinic, and we'll be doing a lot of women's health over here, as well as pain management and everything. So we do have a TCM on board and also physios who are managed on both sides. So, okay, let's start the presentation today. So today, let's go through some myth and facts about what physiotherapy and women's health do, okay? So a lot of misconception is that women's health physiotherapy is only for conditions like incontinence and pregnancy. Actually, physiotherapy can also help with conditions like dysmenorrhea, vaginismus, and pain. So, if your menstrual cycle has always been longer than 35 days, is it actually normal? So actually, it's not normal. If your menstrual cycle lasts shorter than 21 days or longer than 35 days, it is not normal. So I'll be going through about this a little bit more later. Okay, so is it normal to feel pain during your menstrual cycle? Actually, it's a myth. So any pain, including cramps over the abdominal or low back, is actually not normal during your menstrual cycle. You should not be feeling any pain. And if you have pain, then that is something not very normal for us. Okay, so it's normal for me not to be able to insert a tampon or a menstrual cup since I'm a virgin. This is actually also a myth that many Asians believe in. If you actually face difficulty inserting a tampon or a menstrual cup for the first time, it's actually usually because you are too nervous and you are tensing your muscles. However, if you do notice that this happens a little bit more frequently and every time you try to insert a tampon or a menstrual cup, you feel pain, then it might be because you are tensing your muscles too much. And you might have other issues like vaginismus, which I'll be going through later as well. Okay, so I should not apply hot pad during menstruation as it will cause my bleeding to increase. This is actually also a myth, as a conventional hot pad is actually not able to penetrate deep enough to reach your uterus. However, it is able to help to relax your abdominal muscle to make the cramp less intense. So you actually feel better and you will not bleed more if you apply a hot pack during your menstruation. Okay, so I should not do any exercise during my menstruation. This is a myth, as there's actually no evidence that shows that you should not do any exercise during menstruation. In fact, light to moderate intensity exercise during your menstruation helps to release endorphin, which is actually a natural painkiller and it's also a feel-good hormone. So it actually makes you feel less pain and feels better. Okay, I should do more exercise and eat lesser to get to my ideal body shape or my ideal weight. This is a myth. You actually need to find a balance between your exercise and diet. Having too much exercise and a lack of nutrition will actually cause your body to break down your muscles, resulting in a poor body shape. In the long run, you will have increased risk of cardiac problems and osteoporosis. So after looking at these 7 common myths about your body, I'm going to go through a few common conditions that women go through, namely abnormal menstruation, dysmenorrhea, which is generally known as menstrual cramp, premenstrual syndrome, vaginismus, eating disorder, and also low self-esteem. So what is abnormal menstruation? So if you actually experience menstruation that occurs in less than 21 days or more than 35 days, any period lasting longer than 7 days, a flow that is actually heavier or lighter than your usual, and also period that is accompanied by pain, cramping, nausea, or vomiting, you might be facing abnormal menstruation. So how can physiotherapy help? Physiotherapy can actually help by guiding through your exercise progression. Exercise actually is known to regulate our hormones, namely the testosterone and estrogen in your body. With a balanced testosterone and estrogen in your body, it will help to regulate your menstrual cycle better. And also with strengthening exercises, you will be able to get better strength. Okay, so what is dysmenorrhea? Sometimes our menstrual cycle is accompanied by having menstrual cramp, as mentioned earlier. Having menstrual cramps is not normal, and you might be actually experiencing dysmenorrhea instead of menstrual pain. Okay, dysmenorrhea can be separated into two different categories, namely the primary dysmenorrhea and the secondary dysmenorrhea. Primary dysmenorrhea is commonly known to many people as a menstrual cramp, and secondary dysmenorrhea can occur after many years of painless menstruation, and then you suddenly feel pain, and this is commonly associated with medical conditions like endometriosis. So I will actually be going through endometriosis in future talks, so I will not be going through about it in depth today. So how can physiotherapy help with dysmenorrhea? So in general, physiotherapists will be able to teach you Kegels exercise to help strengthen your pelvic floor muscles, stretching exercise like cat pose and cobra pose to help stretch your abdominal muscles and relax them. And also apply modalities like a hot pack and TENS machine to help to manage your pain. Okay, so contrary to most people's belief, PMS is actually a combination of physical, emotional, or behavioral symptoms that starts about 1 to 2 weeks before the start of your menstruation. You don't usually feel it during your menstrual cycle itself, but you will feel it about 1 week beforehand. So common physical symptoms include abdominal bloating, fatigue, changes in appetite, and skin problems. So you will notice you might have a lot more fatigue, you might eat more than usual or less than usual, and some of us will actually get acne problems just before our menstrual cycle. So common emotional symptoms include mood swings, poor concentration, oversensitivity, and anger. So you will start to notice that you tend to get a little bit of mood swings just before your menstrual cycle, and that's how some of us actually knows that when our menstrual cycle is starting. So due to these physical and emotional symptoms, it can often cause us to have changes in our behavior. So these symptoms can vary from person to person and may not be exactly same during the different menstrual cycle of the same person as well. So maybe for the first half of the year, your PMS symptoms might include acne, but after that you may not have acne problem. So it may change even in between our menstrual cycle as well. Okay, so a physiotherapist can actually assist to help you to set out an individualized exercise program to suit your needs. Exercise is commonly known to boost the amount of endorphin in your body, hence making you feel better and have reduced emotional symptoms. So if you feel pain during PMS, a physiotherapy will also be able to help you to manage your pain as well. So when I say pain, it need not include just the menstrual cramp itself. So it can be any other form of pain, like a low back pain, a pelvic pain that you are feeling, or even some other issues around your neck or your back. Physiotherapists can actually help you with it as well. Okay, so mind and body exercises like yogas or Pilates can actually help you to concentrate on your body and allowing your mind to relax, hence reducing the symptoms as well. However, it's very important for us to note that we should be actually guiding and also not trying to overachieve during our exercise. So we have to graduate the amount of exercise that we perform every time. Okay, so next up, I'll be going through vaginismus. So what is vaginismus? So if you actually experience pain regularly during insertion of a tampon or menstrual cup, or during an intercourse with your partner, it might be because of a condition known as vaginismus. So this is a condition whereby you actually have involuntary tensing of the vagina during a penetration. Most of us do not notice it until we try to insert a tampon or a menstrual cup. However, because insertion of a tampon or menstrual cup is actually not very common in Asian population, some of us only notice it when we actually go for a pelvic examination, like doing a pap smear, or when we actually have an intercourse with our partner. So women with vaginismus often find it very painful when they are trying to have intimacy with their partner, and this often leads to infertility and also a tense relationship between the couple. So it can actually cause increased anxiety in the lady, or the partner may actually feel very demoralized or just doesn't want to have an intimate relationship with the lady. And this results in this might result in a strained relationship. So it's very important for us to talk about it with our partner as well. So how can physiotherapy help? So other than seeking a psychologist or a sex therapist, a physiotherapist can actually help to guide you on how to relax the muscles, including manual therapy to relax the muscles, stretches, and also introduce graded touch and tissue desensitization. So cognitive behavioral therapy, which revolve around your thoughts and beliefs, your emotions, and your behavior, will also be performed so that you will be able to overcome vaginismus and enjoy intimacy with your partner. So what happens is when we actually have this pain during intercourse with our partner, it actually causes us to have this belief as well. And this belief will actually affect your emotion and your behavior. And so what we need to do is to break up from this closely linked circle so that we can actually do better in the future. Okay, so next I'll be actually going through eating disorder. Although eating disorder is common, we can have eating disorder, be it we are a male or a female. However, studies have shown that more females actually battles against eating disorder compared to the male counterparts. So two common eating disorder includes anorexia and bulimia, in which one you will have very small quantity of food, if any, or in the form of bulimia, in which you will have a swing between a binge eating episode followed by an attempt to purge. So they will either force themselves to vomit, have laxative, or either have a calorie restriction. So perceived pressures to be thin and exposure by the media promoting ideas to be thin often actually leads to altered body image in a person. So many women actually have a false sense that they also need to lose the muscles in their body, as it results in a heavier body. So they might be actually very thin. However, because of the way they look in the mirror to themselves, they actually feel that they are still very fat, even though it's just a muscle mass and not a fat. Okay, so having reduced muscle strength and totally no fats actually results in a higher risk of heart problems and osteoporosis in the long run due to the lack of nutrition in the body. So it doesn't mean that if you are thinner, you do not have a risk of cardiac problems. If you are overly thin and malnutrition for a long period of time, you are also at a higher risk of having heart problems in the future. So physiotherapists can actually help to manage compulsive exercise that's performed by many with eating disorder and coming out with a proper exercise plan that balance their diet and their exercise itself. So proper education will also be done to aid their recovery. They may not be able to get this once in a few sessions, as the anorexia or bulimia itself might have been with them for many years. So often one with eating disorder will also come to us with a very hunchback, like the one in the first picture, and shoulders that is actually roll forward. This is actually a common method used by many to try to hide their body size or shape. However, by correcting their posture, they will be actually able to experience less back and neck pain that is commonly accompanied with poor posture. So also, when they actually stand up taller and have better posture, they actually look better and actually less bulky in a way. Okay, so Many females are actually faced with low self-esteem during the puberty age, especially more so when they are the first few or the last few who hit puberty within their group of friends. Due to the development of their female features, the early bloomers often try to hide their features by to avoid being too different from their friends who have not hit puberty yet. And also the late bloomers will try to hide their lack of features so that they can actually blend in together with their friends. It is important for us to feel comfortable about our own body and not compare it with others like our families or friends, as each of us is different. You might not have the same size as your friend, and you need not worry about your feminine features as well. Due to them trying to hide their female features or the lack of the female features, they also often choose to slouch and hunch their back to hide their chest region or wear very ill-fitting bras. So very ill-fitting bra or the wrong type of bra during exercise will cause strain at the thoracic spine, the neck, and the shoulders, which actually causes more pain and discomfort for them. So we can actually help to correct your posture through manual therapy or specific strengthening exercise program. However, it's also very important to know how to measure your own bra size, as in Asia, some of the parents do not know how to measure the bra size and they tend to just go to a shop outside to get it. So it's very important for you to take care of your own body as well. So to measure your correct bra size, you need just a measuring tape and a non-padded bra or a loose-fitting shirt if you are measuring it by yourself at home. So you need just to measure the bend of your bra. So keep the tape very snug and parallel to the floor just below your breast area. Round the measurement to the nearest whole number. So example, if your measurement is 35.5, round it off to 36, which is this will be your band measurement, okay? And then you measure the fullest part of your breast, which is usually about nipple level. Round that to the nearest whole number. So let's say this measurement is about 38. So now you take the band measurement and subtract it from your cup measurement and find the difference. So you will take 38 minus a 36, which will give you a 2. So that is actually based on this chart, is actually a B size cup. So your bra size should be a 36B, okay? So with that, I actually come to the end of my presentation. Is there any questions? Okay, since there's no questions, then I will end today's talk. Thank you for attending. So next month, we will actually also be having a women's health talk, but next month we'll be more focusing on pregnancy-related problems. So stay tuned next month. I will share the date and the time on Facebook as well. Okay, thank you. Bye-bye.